that someone's lived experience
That's right.
trumps what's on a paper.
That's right. Absolutely. 100%. My approach when I was seeing patients is that I would ask them about themselves, about, sort of their lifestyle, where they're working, what were some of their fears related to the medicines, and actually show them the medicines, just so people feel involved in the decision, involved, because you don't want to take away someone's agency.
And I think that's a novel idea for a lot of people, because I think when you go into the doctor's office, a lot of folks feel like you're the expert. You know everything, so you tell me.
Yeah.
And so someone like me, it might not even think to push back or to say, how does that fit into my lifestyle? It feels a little presumptuous to say, I need you to make it work with my life. It feels like I'm asking too much of you.
And you're not. And so while the healthcare provider may have expertise on the medicines and on HIV, you are the expert on you, right? I mean, you know what your day's like. What are the things that are stressful? Do you sleep well? How's your eating? All of that.
What's a good way for someone who comes into your office to really get your attention if they need to, and say, hey, like I really, I need a moment with you, one-on-one.
I think, that's such an important thing, to be heard and to actually have a dialogue where, when you say, I've been feeling kind of sad or I've been feeling kind of lonely, that there's someone hears that. My advice to patients who have that experience where they have a doctor that's not hearing them and is not engaging with them and that they don't really feel that presence is get a new doctor. And that's, that may sound harsh, but what you deserve is somebody who is right here with you in that moment. The one thing I can say is that when we think about the doctor-patient relationship, that it should be an exchange. It shouldn't be doc, here's my symptoms, what do you recommend? And that they just answer and that's, write your script and that's the end. That relationship has to be, a back and forth where they get to know you and you get to know them and develop a trusting relationship.
When someone comes in and they don't inherently have a voice, they don't know how do you get that out of them? Get them to share enough so that you can say, hey, you have options based on your lifestyle and who you are. Maybe this will work.
I've had lots of folks come in and again, they feel like they're wrapped up in that shell. And I think the most important thing to accomplish in that first visit is make sure there's nothing acutely going on that you need to fix. But actually what you're trying to do in that first visit is create a rapport, start to develop some trust, start to give them confidence. They can disclose everything with you. It should be, how are you feeling? How are you sleeping? How's your love life? All of that. So that's helping me to get to know you.
I think that trust is so key, because, you can tell people all day the science, but if they don't believe you,
that's right,
or respect you,
that's right,
they're not necessarily going to take that on.
And of course now we also have medicines where you don't have to even take a pill every day. And that can make a big difference for people. And so there's been a tremendous evolution in what we can do. But it only matters. No medicine is any good if people don't get it in their body. And so it's about having that, that provider-patient relationship that lets you say when something's not right and makes me hear you, stop to hear you. Yeah.
And it opens the space for a much more collaborative relationship.
That's right.
You've been saying a lot that really reaffirms that you can't treat HIV in isolation, that it really, it affects you physically, mentally, emotionally, sexually, and the last thing that we need is for HIV treatment to become a barrier to those things. When treatment is doing its job and doing it well, it kind of just fades into the background. And I can start to feel good about my life, about how I'm doing mentally and physically and emotionally, and it just fits in, and I can refocus on the things that are actually important in my life.
You make HIV a tiny part of your life.
Yeah.
That's the goal. Making it as small as possible.
Is that something you communicate specifically to your patients?
Absolutely.
I think that's important that you do that, and that healthcare providers, doctors everywhere do that, because it can be counterintuitive for someone living with HIV, because you might think, I need to restructure, reorient my whole life to make sure that I am on treatment and that HIV is kept in check and I'm good to go. But really it's the opposite. I need to take care of myself and be on treatment so that I can continue to live my life the way that I want.
That's the goal, is live your life the way you want. Obviously, we do clinical trials, and sometimes we do qualitative studies where people will tell us what they feel. And one of the statements in one of those qualitative studies that touched me the most was a person saying, being on this medicine makes me feel normal. And ultimately that's the goal, right? It's to take away, it's to feel like that burden is lifted. That's the goal. Absolutely. I'm so proud of you. You've done so well. Thank you so much.